Hey y'all, it is cold, chilly. I had to get some more lighting in here because it's going down, sun's going down. I really wish I was in an area with a little bit of snow. It'll be nice to have snow coming out the windows, but yeah, whatever. So, back with you all with another video of the pros and cons of night shift nursing. Okay? Dun dun dun. As I explained before in the pros and cons of day shift, if you have not seen that video, go ahead and click back if you have any concerns or want to know my opinions with pros and cons of day shift. But without further ado, we'll get in night shift this time. Same thing. Pros and cons. First pro with night shift nursing is the fact you don't have to deal with all the extraness from day shift. When I say extraness, you don't have to deal with so many doctors being on board. You don't have to deal with, you don't have to deal with, patient families at the same extent because, come night shift, maybe one family member may stay back. Some of them may just leave for the night so the patient can rest. So you're able to focus on just the patient and getting things done. Or throughout the day when the patient is just like, oh my gosh, I'm so glad everybody is gone. I just wanted to rest. My patients know. If you tell me I want to rest, I ain't going to kick family out, but I'm going to say, hey, quiet time is going to be in about 2 hours. My patient want to rest. So you're able to just kind of deal with the winding down situation of it. Another pro to night shift is that I've done both. So I'm not going to say night shift is no busier than day shift, vice versa. But if I'm going to keep it 100 with y'all, because that's what this channel is about, night shift does not deal with half of what day shift has to deal with. And anybody who's telling you opposite, it's not being truthful. Pinocchio knows. Simply because night shift for me is more of normal busy nursing stuff. Yes, of course, you're going to have that time where crazy things happen. You're going to have that time when you got to be on your P's and Q's. But one thing about night shift, you're always going to have, I'm not going to say always, majority of the time, you have that downtime to get the charting you need done. You have that downtime to really look at notes, go through your patient charts. You have that time during night shift versus day shift. Sometimes you may get report behind a day shift nurse and it's like, have you done anything? But if you are a night shift nurse that's never done day shift, because some people got hired for night shift nurse, never worked day shift a day before in their life. Same thing, vice versa. So I think it's good for if you decide to become a nurse, experiencing both, because you're going to have to respect both. So instead of going off on your nurse buddy who's handing you a report, who you like, did you do anything? I got to come in and do this. I got to do that. I got to do that. You know, some nurses that just got behind because it's day shift and they had a crazy day for like, all right, cool. Let me pick up where you left off. But you do get them nurses that's just lazy now. And you got to kind of have a coming to Jesus, meet them out the room. This is my third day coming to you and nothing gets done. But when I come around this corner to walk into work, you on your phone. Something's not added up. You're going to be here with me to finish this and then you can go about your merry way. You do get those too. So you kind of have to pinpoint your stress here. But anyway, night shift, you get more time to get some things done. Cons with night shift would be, if you're not more of an experienced nurse, sometimes night shift can leave you lost because, again, you don't have those resources like the daytime. You don't have that, let me just call this doctor who put this in today to see what's what. Because the residents at night are getting the notes and stuff from daytime. So residents all the time may not have the answers that you need for what you're asking about something that went on in day shift. So y'all trying to figure it out together. A lot of people will say that, night shift is just to keep the patients alive until day shift. And that's just some things that's said around the medical field. And at times you kind of feel like that because it's like you got to fight for a one-time dose of anything if the patient don't already have it in their chart, because some residents are very tedious on not going outside of what that attending said. So they're going to do everything possible to make you keep calling back until it's already day shift. Then you get I'll let day shift handle it. That's when advocating for your nurse at night comes into play a lot, because you don't have to be rude about it. I understand you have certain stuff to follow, but as my license, I have stuff to follow as well. And if my patient is in pain, I understand they may have a history of drug abuse. I understand they may have an issue with this, but if this patient just had surgery and you mean to tell me you're only going to give them Tylenol, me and you are about to have a problem, because if we can't come to a middleman, I'm waking people up at home because we need a one-time dose of something. He's in pain. It's showing in his blood pressure. It's showing in his heart rate. I need something done. So night shift, you do find yourself having to climb through a lot of obstacles to get answers for certain things when it comes to some residents. Not all of them are like that. Not all of them are crazy and ignorant. I'm just sharing some of my experience that I've had with doctors, residents, etc. when it comes to getting some things done at night, because it's like nobody wants to take that ball. Heaven forbid there's a rapid or something at night, because you as a nurse, you're supposed to know everything about your patient. You're supposed to know what's going on, what went on. So when that rapid come and they're running in there, hey, what's this, what's that, what's been going on here? They came in with this, they had this started happening, but it says they have a history of this. Before you push this, I also seen in their allergies, they had this. You have to be on top of it. And that's with days and night shift. What I'm saying is with night shift, it's not the same people taking care of this person per se. And mind you, we're talking about one patient. When you're on the floors, you can have 5 to 6. So you're talking about in 5 to 6 rooms, different cases, and you have to know what's what with every patient. And that's one of the things I love with nursing, is that it's not just one thing to do. So in one room, you're watching heart rate, one room respiratory, one room you're trying to make sure they're not going septic, one room RBC is going. You have to just stay on top of it. And at night shift, with not having as many resources, you gotta make sure you get a good bedside report from day shift of what events went on or what we're watching for, and then be able to maneuver. If the doctor don't know much, I know that let me go ahead and maintain this, or at least I can keep this going, or at least I can fight for fluids until day shift get here to get what the patient may need or change their plan of care. So all in all, they both have their pros and cons to being night shift, where I say more peace, but you're more so on your own per se. And you have to know when to, all right, let me call this rapid. Okay, let me get this done because this is not going to work. And another con with night shift is system downtime. System downtime is when the systems go down and it can be from 1 to 5 a.m. So during system downtime, you're trying to come in, get your patients looked at, pass your meds, get everything done that you need to, because after that, everything becomes paper. And heaven forbid you have a code blue or a rapid during system downtime. It is so much paperwork to get done versus being able to have your computer up. My hospital, we use Epic. It's the difference when you have your computer up and you're able to boom, 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 put everything in versus having to write all this stuff down. Remember what times this is. It is chaos when system time is down. One time system time was down and I just needed to get an order of Zofran for my patient, and system was going to be down from 1 to 5 a.m. Doctor really didn't want to walk up there to sign it. It's, well, I'm giving you a verbal, so put it in. Okay, cool, verbal. Okay, cool. Zofran's given. Then the doctor said, you know what, with this patient, let me get some labs. So you got to fill out another paper for them to get labs. Then you call down the lab to say, hey, I need somebody to come draw these labs. We just got this order put in for et cetera, et cetera. Lab really don't want to move. So in turn, they're like, well, did you fill out the paperwork? Yeah, that's why I'm calling. Did you fill out all the boxes? Would I not be calling you if I ain't done this? Get here and draw this blood for me, please. Because I'm at a trauma 1 hospital. So we are kind of spoiled with having lab to come draw blood, et cetera, versus when I traveled and was in California, or when I go work at CCH and stuff, we kind of get our own labs. And it's a blessing and a curse at the same time, because yeah, I can just go grab it from this patient and go stick them. But it's like, I'm not going to be doing y'all work for y'all no, I'm not going to do that when you could just come get your lab, especially in the background when there's music and stuff going and it's really like you really just don't feel like moving right now. No, that's happening with me. So yeah, system downtime, another chaotic situation. But all in all, if I have to pick between days and night shift, I would honestly say night shift have been such a breath of fresh air, because day shift is another beast. So with that being said, that sums up my video today of pros and cons with night shift. Like, comment, and subscribe, and I will be back for more videos. Stay healthy.